On June 6th and 7th at National in Chicago, when we go through our disc seminar, there's going to be a lot of things that we'll be talking about as far as the intervertebral disc. Obviously, as we move along in our life, the mechanics of the disc change. So we know through authors like Alexander and Fazzi and others, we know that the disc, the nucleus of the disc, is able to be moved. So when we do directional movement, we actually can see movement of the nucleus. This becomes really important when we decide what exact exercises or targeted exercises we're going to be utilizing within. It's kind of ironic. We know when we manipulate a joint, no bones are changing position. But in a young, relatively healthy disc, if we use in range repetitive movement, we can actually move nuclear material. Now, as we move along in our life and our discs start to kind of slowly dry up, then the story changes a little bit. So then as we move along in our life, we see more diagnoses like spinal stenosis. A lot of times we'll have a difference in directional preference. But what I think a lot of times young clinicians and old clinicians for that matter kind of forget is utilizing, and Robin McKenzie said it best. He said, move the patient and see what the symptoms are. And that helps us know what's going to guide treatment. So taking some of those principles and utilizing it as a chiropractor can be very effective in our diagnosis. It also will help us with our non-responders. So if we're talking about a disc herniation case that we all struggle with, would be when they've completely blown through the annular wall. Then we have chemical and pain mediators that are swimming around the nerve root. And those patients who maybe previously we thought were surgical, we know if we're a little bit more patient with them that they also can respond. It's not to say that we're never doing surgery, but really, we always say around here, really on average, we're going to, refer someone for a spinal disc surgery maybe 2 to 4 times a year. So there's a lot of people that are getting unnecessary surgery for discogenic pain. We are going to take this weekend and we are going to go through all the different ideas and concepts that are important for treating a disc patient.